just that there's no accountability.
These three ladies used to be strangers,
It does bring up sad emotions.
but a tragic nursing home experience
I regret putting my mother in a facility.
unexpectedly brought them together.
I'm in disbelief right now.
In 2015, Tracy Pompey's father was found dead in his room at Glen Burnie Rehab and Nursing Center.
He was face down on the floor in his room, and he was covered in stool.
An investigation by the Virginia Department of Health found that facility staff were aware of her dad vomiting stool that day, yet failed to notify the family or a physician, resulting in a delay in treatment.
It could have been different had they just sent him to the hospital.
4 years later, Joanna High School's mother was rushed from what used to be Bonneview Nursing Home to a hospital with low oxygen levels. She later died. High School claims the facility did not give her mom the proper medication. VDH inspection records substantiated her complaint and found that staff misappropriated her mother's money by applying to receive her Social Security benefits without authorization.
They failed my mother miserably. They failed my mom.
Letitia Edwards' mother is currently in a facility that she does not want to name. In October of this year, she says she discovered her mom with a broken leg, but she says staff could not explain how it happened and would not allow her to see an incident report.
It just really pains me that it's not just, my mother that has experienced this. I've witnessed at that facility a lot of neglectful things.
It's stories like these which prompted Pompey in high school to form the group Justice and Change for Victims of Nursing Facilities. They advocate for stronger laws and regulations to protect this vulnerable population.
Our government here in Virginia, we are holding them accountable for what's happening in these nursing facilities, and their silence is deafening.
It's the Virginia Department of Health that's responsible for ensuring that nursing homes are meeting state and federal standards. But as we have previously uncovered, when people submit complaints alleging poor care and conditions, VDH is often very slow to take action.
I found it very disheartening that the Department of Health had not responded.
Get off your rear ends and do something about this. Something. Make people responsible, make them accountable for what their job is supposed to be.
A 2023 performance review of VDH by the Centers for Medicare and Medicaid Services found the state was failing to initiate investigations of the most severe complaints within a required 3-day time frame. CMS data also shows that 7 out of 10 nursing homes in Virginia are overdue for inspection. That's the third worst rate out of all the states in the country.
But why is Virginia so far out of whack compared to other states?
It's unacceptable to U.S. Senators Tim Kaine and Mark Warner, who allot funding for these oversight efforts.
I think it's an embarrassment that Virginia is so far behind other states.
In its corrective action plan submitted to CMS, VDH blames staffing, saying vacancies of inspectors and supervisors limit their ability to respond. It comes at a time when they're also observing an overall decline in the care being provided to residents, and as CMS says it's increasingly concerned with the quality of care at facilities owned by private equity companies and investment firms.
And one of the things that I feel very strongly about is the way money dictates the care, the quality of care. I think our government can do better and should do better.
Then there's the report from the state legislature's investigative unit, JLARC, which revealed a VDH plagued by years of financial mismanagement, operational challenges, and a staffing crisis, which rendered the agency unable to fulfill its regulatory responsibilities. We took these escalating concerns to Governor Glenn Youngkin. How did the oversight system get this bad, and what is your plan to fix it?
Yeah, so let me just back up. When we came in 2022, the Virginia Department of Health was very troubled, is how I'll describe it. And they were troubled in lots of ways. One of them was that they had not been able to really put together the organizational structure to provide the kinds of oversight necessary. So we have been working on lots of things in the Department of Health, and in fact, The JLARC study was encouraging because everything they listed we have already been doing.
But Youngkin says he's confident that VDH Commissioner Dr. Karen Shelton can right the ship. After VDH initially declined multiple interview requests, Shelton did eventually agree to sit down with me. So what I've been able to gather through looking at federal data, looking at public records, is that when it comes to VDH's regulatory responsibilities, it seems that the agency is significantly falling short of meeting those goals. Is that something that you, as the commissioner, acknowledge?
Well, I think that we all acknowledge that there's been a tremendous difficulty after COVID with a lot of healthcare workforce shortages. So both in the nursing home industry itself, as well as within the Virginia Department of Health.
Do you know around what your vacancy rate is right now?
We have for nursing home facilities, we have approximately 46% vacancy rate at this time.
So almost half of your staff.
Yes.
How is that sustainable?
So like I said, we are taking definite measures in order to increase that. We are looking at compensation studies for our current staff. Some of our vacancies, we have lost staff to other state agencies. Some of the state agencies pay more than we do for the same kind of investigations for other complaints.
In the short term, Shelton says VDH is contracting temporary inspectors, focusing efforts on the most high-need inspections, and they've created a strike team to investigate complaints. But the stakes are high when facilities remain unchecked. A recent congressional report found that nursing home residents are the people who ultimately suffer when understaffing at state survey agencies reduce their capacity to oversee health facilities. Do you believe that there is a correlation between lack of oversight and worsening conditions?
Well, I think it's really up to the nursing home industry themselves. It's the facilities who provide the care for the patients. So it's really incumbent upon them to be providing the best possible care for their patients.
It is, but it's also the state's responsibility to hold them accountable.
Absolutely.
And to that end, Shelton says Virginia is abnormally restricted in its enforcement options.
Currently, the state powers are pretty draconian in nature.
Unlike every other state in the region, Shelton says VDH has no authority to impose fines on poor performers, to put their license on probation, or to require staff training. The commissioner is calling on the General Assembly to change those laws with approval from Governor Glenn Youngkin at a time when he's prioritizing reducing government regulations. Is this one of the areas, in your conversations with the governor where he thinks there might be too much regulation?
I think by comparison, as I mentioned, you can look at the other states and other agencies and see that we do not have as much regulation as they do. And we're just trying to get up to speed to give us the appropriate tools to manage our job.
Okay. So yes, no. You'll stick to that answer?
Recently, an increase on unfunded mandates.
The issue of lacking regulation was also brought to a recent State Board of Health meeting. Vicki Runk is the board member who represents the nursing home industry. She believes inspectors have been coming down hard on facilities, but she says for the wrong things.
So while we're short, what we should be focusing on is care-related complaints, not the paperwork, the everyday compliance that is barriers to us focusing on the care.
And she supports VDH's proposed legislative fixes in the long run.
Our nursing home residents are some of our most highly vulnerable population, and they deserve and they need great quality of care, high intensity care, and we are here to help regulate the communities that do that and to make sure that we're working together to facilitate that best care.
And do you feel like VDH is doing a good job with that right now?
We are going forward at a fast pace.
While state leaders present an array of solutions, these advocates remain doubtful.
The lawmakers here, I just feel like they've let us down. They've let me down.
They sure have.
After years of lobbying for change, but seeing little progress.
It leaves me feeling very frustrated, very angry, and just disappointed.
That's why our elderly in nursing facilities are suffering and families are having to go through, losing their loved one.
Shelton also pointed to stagnant funding from CMS for oversight activities, which has not increased in over 10 years. In fact, VDH says it's preventing them from filling at least 8 inspector positions. Both Senators Kaine and Warner said that that is something they would push for in a spending bill. In Richmond, I'm Tyler Lane, CBS 6 News.